Welcome to Chamber Exchange, a TV show. My name is Tim Murray, President and CEO of the Worcester Regional Chamber of Commerce. And Chamber Exchange, a TV show, is an opportunity for us to talk about issues of economic development, talk with our member businesses and organizations about things happening in Central Mass and the region. And we want to thank our sponsors who help make the show happen, which is St. Vincent Hospital and Bank Hometown. And with us in our first segment is Dr. Chintan Patel, who is the Chief of Urology at St. Vincent Medical Group.
Thank you so much for having me.
Welcome. And St. Vincent is one of the sponsors of the show, and just for our viewers, just a reminder, not only a really important healthcare provider for the region, but also one of the top taxpayers in the city of Worcester, which is important for paying the bills, and a major employer, close to 2,000 people directly, but then between vendors, suppliers,
right.
A major economic factor for the region. So, but with that, welcome. And,
thank you.
Maybe you could talk a little bit about your role as Chief of Urology.
Yeah, so, you know, as urologists, we take care of pretty much all issues related to the urinary tract, kidneys, ureters, bladder, prostates. And we take care of men and female. There's a misconception that most urologists just take care of men, but we take care of lots of females with incontinence issues and kidney stones, and again, a lot of cancer of the kidney, bladder, prostate as well. So that's kind of a full spectrum of kind of what we do as urologists.
Yeah, I was kind of joking with you before we came online. I was going to reading the notes, for the meeting. I'm saying, okay, where am I in the life stage, and what should I be looking for or not? But when people talk about urological issues, it could be a whole variety of ways. There's issues of incontinence, there's prostate, kidney stones, bladder infections. Maybe you could just kind of lay that out.
Yeah, so I think I think most urological issues generally creep up later in life. Kidney stones, unfortunately, will affect men and women at any age. But after about 50 is when BPH, also known as benign prostatic hypertrophy, hyperplasia, which is just a fancy term for men not being able to pee well, whether it be slowing down with the urinary stream, not being able to empty, sometimes needing to push to get it out. Those are all symptoms of a prostate becoming more obstructive.
So in my mid-50s, I'm in the danger zone, huh?
Usually mid-50s is when things will start creeping in. And in the ladies, it's generally not being able to hold the urine, incontinence issues. And then as you reference, prostate cancer is a big part of what we do. And generally speaking, around 55 is when we kind of recommend at least start having the discussion with your primary care doctors about prostate cancer screening. Yeah.
So I want to kind of come back to some of the treatment and things
sure.
In a minute. But just, in terms of prior to that, are there things preventatively that you recommend to people or is this just aging, or is it a combination of both?
Yeah, a little bit of both. I think for stones specifically, hydration is king. If you can kind of drink 2 liters of water a day, have some citrus in your diet, limit animal protein, limit salt, those are generally the things that you can do to prevent kidney stones. But a lot of the other stuff that we talked about, the urinary issues, unfortunately, there's not that many controllable factors. Again, we always say exercise, diet, make those kinds of choices that generally help with all the other organ systems as well. And smoking, obviously, is something that will increase your propensity for bladder cancer as well. So that would be something that you can control.
Right. And technology and for people in the healthcare field, I mean, I don't know how you keep up. It's a blessing, I guess, and a curse, right?
Yeah.
But there are new technologies that have allowed you to in terms of treatment and or even diagnosis. BPHS, LUTS, if I'm saying it correctly.
LUTS, yep.
Aquablation. Maybe you could.
Yeah. So when it comes to men not being able to pee well, as I referenced, it's an obstructive prostate. It's like a mechanical problem, and generally we start by medications. And once the medications stop working and or not tolerated, that's when we start talking about procedures, and that's where us surgeons kind of come into play. And there's 6 or 7 different options to open up that channel so that you can get a nice forceful stream going. And after you kind of do your assessments, you pick the right procedure for the right patient. The new kid on the block that you just referenced is called an aquablation, and this is a very slick technology where I do a 3D kind of configuration of a man's prostate under anesthesia, and then I use a robotic water jet. It's a high-velocity water jet. It's the same technology that's used to cut diamonds. It's the same technology that's used to cut slabs of concrete. But we program it so that that water jet resects all that tissue to, again, allow for a nice open channel. And it takes less than an hour to do under anesthesia, and outcomes have been fairly excellent.
Right, and it's important, when some of the signs that come with age or for other reasons for people to be proactive, right? Because if these kind of urinary tract infections just can lead to so many, they cascade into system shutting down.
100%, 100%. My biggest advice is don't ignore the symptoms that your body is telling you. The men and females that get into trouble is like, oh, I've been living with the doc for the last 10 years. The problem is the bladder, which is the muscle, which is the motor, the pump that drives the urine out. The more it works, the harder it works, you're going to damage it over time. And you don't want to miss the window to intervene, because you want to protect the bladder as long as possible so that you don't end up, needing a catheter in your late years of life.
Right, right. And we talked about some of the symptoms affecting kind of men, and in terms of issues with female, how would you kind of talk about that?
Yeah, so with the female population, I think it's a lot of urinary incontinence, and I usually split female incontinence into one of two options. Number one is stress urinary incontinence. That's the leakage that happens with coughing, sneezing, jumping jacks, working out at the gym. And we have an easy kind of procedure to help kind of bulk it up. It's called Bulkamed, actually. It takes a few minutes under anesthesia. And then for ladies with, and men with overactive bladder, where the pump is working on overdrive, we have ways to kind of slow that down. There's a procedure that is pretty prevalent called Botox that people do for cosmetic reasons, but you can also do it for medical reasons, and I inject Botox in the bladder and it works like magic. And there's a sacral stimulation device called Axonics that we also implant, and the results for that have been pretty spectacular as well. So we have lots of tricks in our tool bag to help with incontinence issues as well.
So I assume similar, if people are experiencing those types of situations, if females are having that happen, talk to their primary care,
Bingo, yeah.
Look for referral, and kind of get it addressed sooner rather than later.
That's right.
So I guess as you kind of do that, both on the male and female end, kind of the diagnostic piece, you talked about some of the use of drugs, pharmaceuticals,
yes,
that might be used prior to surgery.
Yeah.
What's that point where you say, okay, the drugs have done their purpose or outlived their usefulness?
That's a great question. I usually ask very binary questions when I see my patients. I say, are you happy or not happy, right? And if they are happy as can be on the medication and their flow is good, I let them be. But if they say, I'm not really doing too hot, or I'm having side effects from the medications, that's when we pivot to kind of more procedural interventions.
Mm-hmm, mm-hmm. And you mentioned that I just want to make sure I got it right. We covered it. That aquablation procedure for men with enlarged prostates, that's the laser.
That's the water jet.
The water jet.
Yep.
Okay. Okay. Anything else we want to talk about just in terms of people should be looking for?
Yeah, no, I think, like I said, I think prostate cancer is near and dear to my heart because that's such a big part of what we do. And I think the name of the game is talk to your primary care doctors. It's something that you need to be sort of proactive about because the pendulum has kind of swung fairly in both directions over the last 10 years, and sometimes it takes the patient to bring it up to the primary care doctors to say, hey, what are we thinking about prostate cancer screening? What do I need to do? Especially in men with a family history of prostate cancer.
Right, right. And just given the challenges, I mean, I'm like a broken record on the show, but so many of our member businesses and the sectors that they're in, the number one issue is kind of access to talent and workforce shortages. But in the healthcare industry, that's particularly acute. So it's really, really important for people to be their own best advocates, to be proactive in talking to primary care, PA, nurse practitioner, to be able to get to a specialist like you.
I tell all my patients, you got to be the squeaky wheel in this kind of industry now. You got to kind of be proactive, make a few phone calls, say, hey, if somebody says, next available appointment is 4 months, say, hey, put me on the cancellation list. There are ways to kind of navigate the system. And of course, in our practice, if somebody needs to be seen, we'll see them right away.
Okay. Before we wrap up, I know you got a couple of young daughters watching the show.
Yes, that's right.
Want to give them a wave?
Ava and Esme, love you.
All right, good stuff. Dr. Patel, great, enjoyed the conversation. Yes. Thank you for all you're doing, what St. Vincent does for the region, both from a healthcare perspective and economic.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.